Governor Bill Lee just signed an executive order which allows the Tennessee National Guard to help hospitals if needed. The order allows guardsmen to work in hospitals and perform the roles of nurses or other medical staff.
And as News Channel 5's Kyle Horan learned, hospitals are already moving staff members around to make up for the COVID-19 pressure.
I know that especially during the very beginning stages of COVID-19 happening, we had to shut a lot of areas down. Our procedures went down to only needed procedures.
When coronavirus first put hospitals into emergency mode, the hospitals immediately began to change the way they operated. Just ask Catherine Zimbardi, a nurse at St. Thomas West.
We went kind of to the drawing board and figured out how we can use our staff in other areas like the ICUs to keep our employees safe, our patients safe.
Zimbardi says nurses, doctors, and other staff have been doing jobs to support each other.
So if that's sometimes a doctor grabbing a tray out of a patient's room just because they know our nurses need some extra hands, then they've done that. And our PCTs helping our nurses where they can. Our nurses doing as much as they can to communicate well to the doctors.
She says they're happy to do so. It's a calling medical professionals tend to answer. But also, she says staff are not immune to the stress of the pandemic, both inside and outside the hospital.
I think that nurses in general are kind of up and down just with the public is. I think everyone has felt like, okay, we're maybe through this and things are maybe going to be back to normal soon. And then we're having a surge and things aren't quite back to normal.
Even with all of that, they still put their patients first. Kyle Horan, News Channel 5.
Kyle, thank you. There is a new push to make sure people with diabetes get priority when it comes to the vaccine. Researchers at Vanderbilt University Medical Center say with type 1 or type 2 diabetes, people are 3 times more likely to have a severe illness or require hospitalization. The researchers looked at more than 6,000 Vanderbilt patients who had COVID-19. They say people with diabetes should not live in fear, but do need to do what we should all be doing: washing hands, staying 6 feet apart, and wearing a mask.